It's more about getting patients what they need and not having them only at the mercy of their local community of physicians or surgeons.
The Surgery Center of Oklahoma is a very successful type of practice. People are traveling from all over. Why don't we use facilities that are already existing and turn them into Surgery Center of Oklahoma type centers? And we can bring surgeons to those locations. We're ACE's national surgical team, but you'll get your surgery wherever you want it.
So welcome to Leadr Podcast, episode 28. And I am so pleased and thrilled to have our latest guest speaker on today, Dr. Ronen Elefant. I always think it's important to talk about how we know each other. And you're like, how do we know each other? So I found you, you may not know this story, but I'll share it with you. I found you on LinkedIn, which I spend a lot of time on because a majority of my clientele and community is on LinkedIn. And I think you had posted something around your new company, which we'll definitely talk about. But I thought it was so captivating that I sent it to my intern and said, you need to get a hold of this guy and he needs to be on the podcast. So I do want to talk about that. But before we get that's basically how we know each other. If you have a different memory.
So yeah, I mean, I got an email from, I guess, your intern asking me to be on the podcast. And truth is, I didn't know who you were, but when I looked you up, I remember texting my COO like, "Hey, look at this! Like, I got an invitation to be on this podcast. This looks like the real deal." So I was very excited to come on the program. And then I was checking out some of the episodes and really appreciated some of the content that you've been putting out there and the previous guests. And I, obviously, I'm very honored to have been asked to be on this podcast.
Yeah, of course. It's fun, first of all, to have you on. But secondly, we have a ton of mutual contacts. I don't know if you know that. Did you happen to watch the last episode, a couple episodes ago, Dr. Porterfield? I think I tried to make an introduction to you too. Because I definitely think you should know each other. If you don't already, you should. Yeah. You're both entrepreneurs and surgeons. You're a general surgeon, correct?
So I'm trained in general surgery, and I did a fellowship in surgical critical care. So my specialty is trauma surgery and emergency general surgery. But the company that I'm forming is more elective general surgery.
Yeah. Okay. Well, so let's start there. Let's start in the beginning. Tell us about your background, your story, and how you came to become an entrepreneur as a physician.
Okay, so I guess I'll go way back, which is
go way back.
I'm actually I was not born in the United States. I was born in Israel.
Wow.
And my dad was American, but he moved to Israel at the age of 19. He went there to join the military. He grew up religious and went to something called a yeshiva, where they do a lot of Judaic studies learning. And during one of the Israeli wars, people were saying psalms in solidarity with Israel. And he was the type of guy that said, you guys will just be here praying and I'm going to go and fight at the next war. And so that's what he did. And the reason I say that is because hopefully, through the podcast, you'll get to understand who my dad was through my personality. And he passed those kinds of traits along to me. So he moved to Israel when he was 19, met my mom shortly after. I was born there. I lived there till I was 9. And then they decided to move to the United States for just a better opportunity. They thought it was going to be short term to start a business. My dad was entrepreneurial. I think it was going to be like a 4-year stint, and it ended up being a long time. So we stayed here for pretty much the rest of, my life, their life. I would say, again, the reason I bring that up is because I feel like I'm living the American dream, and I'm definitely like an immigrant who is appreciative of the opportunities that I have here that I don't think I would have had I just lived in Israel my entire life. I love Israel, but the things that I get to do here, whether it's in medicine or flying, which we'll get into, I couldn't do in Israel. I was always very studious in school, never thought that I was going to go into medicine. I actually studied math and physics in undergrad and wanted to be an engineer. So I wanted to do biomedical engineering. And it was kind of funny because my Jewish mom heard biomedical engineering and she's like, "Oh, you're going to be a doctor?" And I'm like, no, I'm going to be a biomedical engineer. in the master's program for biomedical engineering, we had to take anatomy with the medical students. And that was my first taste of what medical school would be like. And I was the type of person that if I wanted to go into something, I kind of went all in, told myself that I'd go to med school to be the best biomedical engineer that I could be. But very quickly, I realized that as an engineer, there's very little upward mobility, or that's what I thought. And that as a physician, I'd have a lot more upward mobility. And I kind of switched gears and said, okay, I'm going to be a physician. And it was almost immediate that I thought surgery would be the way to go because it's like engineering of the human
Mm-hmm.
body. So after medical school, or actually, I'll pause there for a second because growing up, I was very much into aviation. Always loved airplanes since I was a kid, and my dad again was very gracious to kind of fund my dream of getting my pilot's license. I had my first lesson when I was 13, but I was too short. I couldn't even reach the rudder pedal, and I had to wait till I was 19 to get my license when I was tall enough to actually reach the rudder pedals.
That's amazing.
But the reason I bring that up now is because in medical school, I befriended somebody whose fiance was a flight instructor who was trying to build ours. And he and I were talking, and he said, look, if you rent the plane, I'll teach you for free, like for all the ratings. So, like instrument, commercial, multi engine, all that. And I knew that once I got into third year of med school, there wouldn't be much of an opportunity to do any of that stuff anymore. So, my first 2 years of med school was sitting through classes, and the class would be like an hour long, but no matter what, you still had to go home and read like 5 hours worth of stuff for that 1 hour.
Wow.
So I figured I might as well go to the airport and get my ratings and just sit in the library at night to read what I
Mm-hmm.
missed during the day. So I would skip out on class, go flying. I got like all my ratings. I think I actually took the test for like my multi-engine commercial license the day before I started third year of med school, which is the clerkships,
Mm-hmm.
which is like after that, there's no time to fly. So finished medical school, didn't really do much flying after that. Got into residency. I was at a residency in general surgery in New York for the first 2 years. And then
Where'd you do your residency?
Montefiore in New York.
Okay.
And I transferred to Temple
Mm-hmm.
as a third year.
Mm-hmm.
They had a lot of trauma there. I thought that, so another funny story, Montefiore is in the Bronx and is notorious for bad traumas. And I remember after I switched to Temple, it was my first night on call in Northern Philadelphia. I called my wife the next morning telling her that like the Bronx was Disneyland compared to North Philadelphia when it comes to trauma. That
Wow.
that one night, the first night it was just insane.
You're
Um,
saying Philadelphia was worse than the
yeah,
Bronx?
yeah.
Wow.
North Philadelphia was so bad. I don't know if you're familiar with what a thoracotomy is, like an ED
Of
thoracotomy, where you
course.
basically
Yep.
have to open up the
Yep.
chest.
Yep.
It was not unusual for us to do multiple of those a night. I think in the Bronx we did maybe one or two a month, maybe a little bit more frequently, but there were nights that we did three or four in one night in Philadelphia.
Holy
So
cow. And that's
yeah,
all trauma. Those all what? Gunshot patients?
gunshot wounds
Yeah.
basically, all gunshot wounds. A lot of like gun violence, young kids.
Wow.
Just terrible, terrible place. Good for training as a surgeon,
Yeah.
but it can get to you. I
Of
remember
course.
asking my program director, who was there since medical school. She did her medical school,
Mm-hmm.
residency, and then an attending. And I said, "How do you still do this? Like this just gets to you." And I don't think she had a good answer. And it's
Mm.
just very tough. So finished that residency, and then I went to fellowship in Baltimore, which was also a great place to train. And then when I finished fellowship, I had a couple months before I was going to start my full-time job. That was in Hartford. I wanted to take time off because obviously after years of training, you want some vacation, but I had to still make a living. So I did
Mm-hmm.
what's called locums, which is basically like moonlighting, a
Mm-hmm.
couple days here and there every month. And it was at different locations. And I wanted to also get back into flying. So I rented an airplane and got an instructor to fly me back and forth to these locations. Even after I started my full-time job, I kept doing that about 3 days a month. And I got to the point that I was comfortable doing it without an instructor. And I remember telling my wife, like a month into it, of the full-time job, or maybe 3 months into the full-time job, like I really like the locums thing better and I want to do that full-time. She didn't want to have that because there's like
She's
no
like, what are you
stability.
doing?
Yeah, she's like, this is not like a
I just
stable job.
endured medical school and residency, and now you're doing this.
Right. So like, there's no stability. Like technically it's like month to
Right.
month work.
Yeah.
So I kept doing it on the side. Obviously, like, we had a rough time kind of figuring out like how many days a month would be okay to be out of the house on top of already being out of the house for
Mm-hmm.
call for my local hospital. But I wanted to support my flying habit, which was a big, part of what I like to
Passion.
do.
Yeah.
And I bought my first airplane, like a small 4-seat piston airplane, and I would fly all over, like Philadelphia, South Carolina, Florida, New York, to do like 3 extra days a month. Then about 4 years into doing that, like both the full-time job and an additional 3 days, somebody called me up who I knew from the locums world and said, "Hey, we need a trauma medical director in central Pennsylvania. You can fly back and forth. You don't have to move here, but I can't have you do this 3 days a month. Like, this is going to be like a full-time job, about 2 weeks a month, on average."
Mm-hmm.
And I decided to jump all in. And I've been doing that for the last 7 years as trauma medical director here at a level 2 trauma. I made it a level 2 trauma center. But in addition to that, I've always been very entrepreneurial. That's another thing that
Mm-hmm.
I've gotten from my dad. And even when I finished fellowship, the whole idea of like traveling to work and flying and all that was something that I wanted to share with others. I just didn't know how to do that. So this company that I started, ACE's National Surgical Team, I actually registered it as a business in 2015. And I was just cleaning out some of my, old drawers. And there's like handwritten business plans from 2015 that only materialized now in 2025. And
So you put it on ice for 10 years.
yeah, I mean, I always wanted to make something of it. I guess I just didn't know
Mm-hmm.
how to make it happen. And I
Right.
surrounded myself with the right people over the last year.
Mm-hmm.
Um, Oddly enough, through LinkedIn
Mm-hmm.
and through my full-time job. So I met somebody through my full-time job who is more of the business aspect of medicine.
Mm-hmm.
She has that background and was able to help me make this happen. And also I met somebody in the marketing world who I shared the ideas with, and I met
Mm-hmm.
him through LinkedIn. He loved the idea and he's like, "Hey, you got to make something out of this." And
Yep.
with those people around me, right? When you build the right team, then
Yeah.
you can make it happen. And I
Mm-hmm.
couldn't do it alone, obviously. That's kind of where we are at now.
Current day. Yeah.
Yeah, so I started, making something of the business a few months ago,
Mm-hmm.
and the idea stems from a lot of my independent reading in healthcare economics and economics in general. And I think that a lot of the problems that we see in medicine nowadays stem from the way we pay for healthcare, which is through insurance.
Mm-hmm.
I think the patient dissatisfaction, the physician dissatisfaction, all has to do with the fact that the physician-patient relationship has been eroded and everybody answers to somebody else. So neither the physician nor the patient answer to each other. We answer either to the hospital system or to the insurance company or to the government, which is the
Mm-hmm.
biggest insurer in the United States. And again, this business is based on a lot of like philosophy.
Yeah.
And things that I've read over the years. One of the more monumental books that I read regarding this was like I think it came out in like 2007, but it's Who Killed Healthcare by Regina Hertzlinger. She was a business school professor in Harvard, and she wrote about exactly that basically, the government, insurance, and hospitals have destroyed healthcare over the years. And we really got to go back to what it used to be.
Yeah.
And one big way to do that is for the consumers of healthcare, which are the patients, to pay directly to the purveyors of healthcare, which are
Yeah.
the physicians.
Right.
And so there's a few
Almost
places.
like the old days where the doctors show up at their houses and they have a personal relationship with them. I want to say, what was that one movie that I definitely grew up on that had like the country doc that shows up at the house? Little House on the Prairie.
Yeah.
They used to have the doctors come in and see the kids and stuff. I know it's very different, but that's what
Yeah.
I'm picturing. Yeah.
No, exactly.
More
And that's the way
intimate.
it
The
should be.
relationship is more intimate.
And I
Yeah.
think a lot of people are seeking that. We see that
Mm-hmm.
with direct primary care, right? A lot of people are willing to pay out of pocket to have a concierge style
Concierge. Yeah.
doctor,
I'm
which
one of
is
them. Yeah.
yeah, and which is basically what a doctor used to be, right?
Mm-hmm.
To make home calls, or
Yep.
to be available on the phone whenever you need,
Right.
and to not have to wait 6 weeks to see a doctor, right?
Yep.
So I think the healthcare environment is ripe for this kind of change.
Mm-hmm.
And so there's a few surgery centers around the United States, like really very few, I would say like less than 10, maybe even just a handful of surgery centers that charge cash for their services.
Okay.
They're transparent about what their pricing is. So they even have their all in bundled price on the website. You
Mm-hmm.
don't get a separate bill from anesthesia. You don't get a separate bill for the facility. It's just, hey, if you want to get your gallbladder out, here's the
Mm-hmm.
price. The most well known one is Surgery Center of Oklahoma. So I came across it um, around 2010 or 2013, and they have been around since 1997. I went to the location to see it. I met with the founders, Dr. Keith Smith and his partner, and I've spoken to him many times over the years. I wanted to model something like that, and for many years I thought that I would have to like build a center like that.
Mm-hmm.
And I live in Connecticut, and it's a very difficult state to justify another healthcare facility, right? There's like certificate of need and all that.
Mm-hmm.
Um, and also, it's a large capital investment that you have to make if you want to build a surgery center. It's a couple
Mm-hmm.
$1 million. But over the years, and where ACEs came from is I figured, you know what, this is no longer, or let's turn this hardware problem of having to build another surgery
Like a
center
brick and mortar
into
strategy.
like
Mm-hmm.
let's make it a software problem,
Yeah.
meaning you just need the physicians to just go to an pre-existing facility.
Mm-hmm.
Like there's probably about 9,000 ASCs across the United States.
Mm-hmm.
Not all of them are at capacity. Why not find the ones that have open ORs and time, and utilize that time to everybody's advantage, right? The patients, the physicians. Yeah.
Let me just interject something on what you just said, because I can validate, and maybe even to a degree that you may or may not even be aware of, at least in the West Coast, which is what I largely represented for surgery centers for Intuitive, which is my former employer. At least in the West Coast, every single day they had business development people pounding the pavement, trying to find on staff physicians, because each physician in the local area all go to their local hospitals, but they also have the low acuity patients, or even ones that could be done in an outpatient setting, that is up for grabs, right? And so every single local ASC in this community, in my area, are always looking for surgeons, and specifically skilled surgeons for specific things. So it's a grossly under vetted and under subscribed plan, having an ASC. So I think you mentioned that they're looking for doctors, but I think that's like their lot in life. And I don't want to speak on behalf of ASCs, but I could tell you that that's usually what they get up every morning looking for, is more
Yeah.
surgeons so they
Yeah.
can grow their volume.
And in fact, I work in a hospital setting most of the time, and I know
Mm-hmm.
how inefficient it is to do surgeries in the hospital
Yep.
for multiple reasons. One of which is they're inherently inefficient
Block.
because the incentives are misaligned,
Yeah.
but also doing a surgery at a hospital for those reasons and more is super expensive. So
Mm-hmm.
if you can shift those surgeries, which can be done at an ASC, then they should be done at an ASC, and
Mm-hmm.
only save the OR time that's more valuable to use in the hospital setting for those surgeries that have to be done in the hospital.
Right.
And most surgeries can be done at an ASC.
Yeah. Okay. So I understand somewhat the problem. You had identified an opportunity to be able to travel and not be in one place, and be a solution to what you provide to many instead of a fixed location. Right. Um, but the problem to solve was bigger than that. I'm assuming it's more about getting patients what they need, and not having them only at the mercy of their local community of physicians or surgeons to have access to, but getting access to the premier surgeons by just having them get on a plane and come to you, right?
Well, we can hold off on the plane for 1 second to
Okay.
explain what we're doing here. So what I saw was, hey, you know what? The Surgery Center of Oklahoma is a very successful type of practice.
Mm-hmm.
People are traveling from all over to the Surgery Center of Oklahoma and other places like it. There's one in Indiana. There's one in Oregon. It's mostly on the West Coast, but there wasn't much on the East Coast, maybe one or two in the Midwest. But why don't we, again, use facilities that are already existing and turn them into Surgery Center of Oklahoma type centers
Mm-hmm.
where they have cash prices, where they have bundled prices,
Mm-hmm.
and we can bring surgeons to those locations. Whether I do that with private aviation over time, which
Mm-hmm.
again, that's a capital investment. So depending on how the business grows, I can make that happen. For me personally, as a pilot and surgeon, I can fly to these places, right? So
Mm-hmm.
we have a facility in Wisconsin, so I fly to Wisconsin. We have a facility in South Carolina, so I can fly to South Carolina. And but I'm also utilizing surgeons throughout the United States who want to come on board. So I have a partner, for example, who spends half his time in Buffalo, New York, and
Mm-hmm.
half the time in Virginia. And he said, "Hey, you know what? Like, let's do this in these two places." So I'm now, looking for a potential partner in New York, looking for a potential partner in Virginia, and basically providing the services with a surgeon that I have in those facilities.
Mm-hmm.
And we're doing that with general surgery to start, but it's open to multiple specialties. So we want to be a multi-specialty group that is sort of a virtual
Right.
practice, right? Where it's
Yep.
like, okay, we have our shingle, we're ACE's national surgical team. Most of the pre and post op stuff is all virtual, but you'll get your surgery wherever you want it, and we'll bring the surgeon for you to do that. And again, any specialty that's needed, we can source that. And we just need to know where the patients are and where they want to have their surgery. And some
Okay.
patients are okay traveling, right? Like
Mm-hmm.
so
They'll
some
come to you, you're saying.
Right. So some patients,
Mm-hmm.
again, like I said, travel to Surgery Center of Oklahoma. Well, if you're
Yep.
already traveling, why not pick Charleston as where you want to have your surgery and bring your
Right.
family for the weekend? You
Right.
know?
Yeah. Make an
Yeah.
event of it. Wow, there's a lot to unpack there. So I'm just trying to understand your business model. It's almost similar to traveling nurses, right? Where they do, but
Correct.
they do more like long-term contracts at a
Right.
time.
They do long-term contracts, but you can kind of see where in my journey of traveling myself to
Mm-hmm.
these different hospitals to provide care,
Mm-hmm.
and the economic roots of my ideas of how healthcare should be paid for
Mm-hmm.
all kind of merge in this business model,
Right.
right?
Yep.
But yes, it's essentially a traveling model. It's in a way, I don't want to say that it's locums because locums has a negative connotation to it, but the moonlighting that I did for the inpatient world
Mm-hmm.
is what I'm creating for an outpatient world.
Right.
And I'm saying, okay, I can bring physicians to an outpatient setting from wherever, whether it's
Mm-hmm.
local or from outside, and I'm providing the platform to have that done, and hopefully getting the surgeons paid more than what they would normally make, where they feel like they're appreciated, just like I felt more appreciated when I did my moonlighting.
Mm-hmm.
Because number one, I didn't have to deal with the local politics. I made my own schedule. I chose when I wanted to work and when I didn't want to
Right.
work,
Mm-hmm.
and I felt like I was getting paid what I was worth. I knew
Right.
what my time was worth, and
Yeah.
all those things are also byproducts of ACEs in the outpatient setting.
Mm-hmm. So do you just going back to the mechanics of your company, so are you outreaching to ASCs all throughout the US? Are you worldwide or just in the nation at this point?
We do want to work worldwide. I have
Okay.
spoken to some people who have connections in the Philippines and
Yeah.
in the Middle East.
Mm-hmm.
We're not at the point that we can grow that quickly. I want to
Yeah.
focus my efforts right now on the United States, but the model is very easily scalable so that we can open up anywhere. Um, we focused on the specific places for personal reasons. To me, like I like to vacation in Charleston, so I was like, let's make that a work and vacation type of trip.
Yeah.
One location in Connecticut, which is just closer to home, and then Wisconsin, there was already a facility that was up and running and ready for something like this. But yeah, we're going to focus our attention first on uh, places in the United States, and then once we have like the electronic platform that we want and
Mm-hmm.
the mechanics of how to do it, it can really be opened up anywhere.
Okay. Got it. And for if I'm a physician listening to this right now and I'm interested, one, we'll definitely put your contact information and your company information in the show notes so people can reach you. But what about licenses, medical licenses? Does that come into play?
Oh,
How do you manage
absolutely.
that? Yeah.
Yeah, so yeah, that absolutely is something that comes into play, and something that I actually posted about because I'm sure you've heard of the IMLC, which is
No.
okay. So the IMLC is like a pact between states that if you're
Hmm.
licensed in one participating state, medical license in one participating state, you don't have to go through the same application to get a license in another state. Not all states participate right now. I think only 35 of them do, but I believe that within the next 5 years, all of them will be participating.
Okay.
Um, so I thought that that would make the process a little easier, but
Yeah.
it's still very cumbersome, and it's really a shame because when I applied to my Wisconsin for my Wisconsin license, for example, I applied to be on the IMLC. When I
Hmm.
got that approved, I applied for Wisconsin. It still took at least 4 to 5 phone calls of bureaucratic,
Yeah.
red tape that I thought would not happen because of this IMLC.
Right.
But what I tell the surgeons who apply to work with us is that as soon as they intend to work with us, if they don't already have the licenses in the states that we operate in, to
Hmm.
apply to IMLC right away. Even
Got it.
before they start with an interview with us, if
Hmm.
you're serious about it, you should have an IMLC license, and that supposedly speeds up the process a little bit. Unfortunately,
Hmm.
it still requires a couple phone
And the
calls.
calls are, I'm assuming, to med staff, and they have their own credentialing process,
It,
or
it's
no?
to it's to the licensing body, so it's like
Okay.
to the Wisconsin, licensing board. They were very helpful on the phone, but again, it shouldn't take 4 phone calls if you're. It's
Yeah.
like, yeah, I think the post that I did about it was how licensing is like the
Inefficient.
DMV. It's
Yeah.
like, yeah, it's like going to the DMV.
Yeah.
You know, it's
Which
like,
no
oh,
one wants to do.
you filled out the wrong form. You got to do this. You got to do
Right.
that. Or this didn't come in. Well, I sent it 2 weeks ago. The next time I'll send it certified.
Yeah.
Yeah.
Don't you think that that's because there's a new factor here that you're kind of disrupting a traditional brick and mortar or shingle process where people are showing up in the traditional location of their ASCs in the community and nothing's really disrupted, but you're really kind of upsetting the apple cart, if you will, or flipping on its back, doing things differently, which is far more efficient, but maybe they're not ready for that yet, meaning mentally and process wise.
Yeah, I think there's definitely an element of that. I mean, one of the reasons that there's even different licenses within different states is really as a barrier to entry, right? They want to
Hmm.
limit the amount of people that come in. The business that I'm building, you're absolutely right, is all about efficiency, and we're
Hmm.
trying to make things as efficient and automated as possible.
Hmm.
And that goes against the status quo.
Yeah.
And so that status quo needs to kind of catch up, but it will take a long time. But I think people are realizing, and again, as you know, with after COVID, since telemedicine became so
Prominent.
ubiquitous,
Yep.
and also like this online platform of like healthcare, like Amazon now has healthcare and all,
Mhm.
there's like healthcare delivery across state lines, and you need to be licensed across state lines. And again, like I said, maybe in 5 years all 50 states will participate, but maybe in 10 years it'll also just be a completely different process. Like
Right.
if you're a licensed physician and you can practice medicine somewhere in the United States,
Mhm.
why should you not be allowed to practice medicine everywhere? Right?
Right.
Like if you're a bad doctor and you don't qualify in one state, fine, you don't
You
qualify
shouldn't
anywhere.
qualify anywhere else.
But
Yeah.
if you qualify somewhere, you should be able to
Mhm.
be qualified everywhere,
Yeah.
right? And it's not like law where, okay, there's different laws for different states, so you got to pass the board for this state or whatever. Like
Mhm.
taking out a gallbladder in Connecticut is the same as taking out a gallbladder in Wisconsin.
Right.
Yeah,
Yeah.
yeah,
Side note, I was
yeah.
born in Appleton, Wisconsin.
Oh,
Part of the
interesting.
Midwest. I was only
Yeah.
there for 6 months of my life, but I use it
Okay.
when I need to. So
Oh,
I'm
small world.
technically a cheesehead.
Okay.
All right. Well, cool. So, how long have you been making a run at this? I know you had mentioned that the idea and the business name came to you in 2015, and here we are in 2025. And I believe you said just a few months you've really kind of been pushing it out. How has it been received? What are the questions that are coming up? Give us the landing?
Yeah, so we saw our first set of we operated on our first set of patients in November, and
Through
we already
ACEs.
have through ACEs,
Okay.
and we have another 2 days that we're going to be operating in December,
Mm-hmm.
right? So we're hoping that every month we'll have a certain number of days of operating
Mm-hmm.
at any one of these locations. We're hoping we don't have any patients yet in Connecticut or South Carolina, but we haven't done as much advertising.
Mm-hmm.
There's actually a society in South Carolina for independent physicians, and
Mm-hmm.
they have their annual meeting in February. So we're going down there to advertise our services and hopefully garnering patients. But I'm hoping that, again, starting last month when we saw our first, or this month when we saw our first set of patients earlier in the month, it'll be 2 to 3 days at least in any one of these locations where we offer the surgeries.
Okay.
Yeah.
And
Um,
is your goal to expand to every geographic area, or are you still planning on staying pretty small and nimble and only have your program at 5 to 10 different surgery centers throughout the US? Or is it far and wide as far as you can go? What's the
Yeah, I
plan?
mean it's really far and wide, right? Like it
Okay.
just I need the right physicians
Mm-hmm.
and in the right locations, and I
Mm-hmm.
need the right ASCs. So we're looking for ASC partners, we're looking for physician partners, and you can go on my website acessurgical.com. It will kind of give you the profile of what kind of surgeons we're looking for. This also just borrows from aviation, and there's a lot of references to like Top Guns, because this is not for everybody, right?
Mm-hmm.
Obviously, in terms of like traveling and the independence, there's definitely a lot of physicians that like being a hospital employee,
Right.
and
They like
and
the stability.
you're right. They want the
Mm-hmm.
stability. And this
Mm-hmm.
is for people who have the entrepreneurial spirit, who are willing
Mm-hmm.
to kind of like jump into the deep end of the pool, even if
Mm-hmm.
they're not sure they know how to swim.
Mm-hmm.
And we're ironing out a lot of the kinks now,
Mm-hmm.
but they have to be adaptable,
Mm-hmm.
right? And they got to be tenacious, and they need to have those qualities to really succeed on our team. And
Mm-hmm.
it's not for everybody.
Yeah.
And also, if we take somebody on and we see that it's not working out, like, you don't necessarily stay on the team
Mm-hmm.
just because you started on the team. In fact, a couple years ago when I went to business school, and one of the things that we had to read was the Netflix culture, which they give out to their employees, and it talks exactly about that. Like,
Mm-hmm.
you know most people will say that, like, people at work are like a family, and they basically say, like, no, it's not a family, it's like a sports team, right? And some people can stay on the team and some people don't, and it's not
Yeah.
a reflection of you that you're bad or whatever. It's just you don't fit within the team, you don't stay on the team. It's
Right.
not family that, like, you're here for life no matter what. And
Yeah.
that's the philosophy of this as well.
Got it. Yeah. I mean, just like any other business, people age in and age out, meaning not so much their actual age, but they were right for that time of that company's need. And sometimes they grow out of the need, or they are not the person they need anymore. And I think those that kind of can self select are better suited, right? This isn't something for me anymore. But those that try to just stick around, just to stick around, and then other people have to tell you to leave, that's when it gets a little problematic.
Yeah. In fact, actually, going back to what you were asking about, like the licensing,
Mm-hmm.
one of the biggest tests for me is, if you can handle it, is if you can go through the licensing process on your own. Like, we're not
Mm-hmm.
going to hold hands.
Right.
We're not going to hold somebody's hand through the licensing process. But if you're the type of person that's not going to give up, or be on, or you'll be on top of your license to make sure that you get it in time so that you can operate with us, next month, then I already know something about your personality,
Right.
right? And
You're
that,
going to
that
get
you
it
don't give
done.
up easily. Exactly.
Right.
You don't want somebody who just says, this is too hard, or, this is a pain in the ass and I'm quitting.
Yeah. You just described the life of an entrepreneur, which both of us are now one of those people. And every day is a challenge, but I love challenges. So it's just my DNA. But there are other people that don't want to be challenged. They do want to show up somewhere every day, punch in, punch out, have someone tell them what to do, and that makes them happy. And so I am never there to judge people and where they are and how they want to show up, but I do think it takes a certain person that is just a driver, kind of a challenger type, that wants to do more and kind of challenge status quo. So the appeal to physicians is what? That they have more flexibility, more freedom. They kind of work for themselves. They could potentially make more margin. I'm assuming the amount that the patient pays is around the same, whether they pay through the insurance or pay you guys directly, but you're getting more, right?
No, so it's actually much cheaper. So
Cheaper
it's much
because,
cheaper to go through us. I mean, not for the patient necessarily, but
mhm,
again, most of these patients will come through their employer who is self-funded, who
right?
is outside the insurance. But our cost, I mean, I could tell you on the general surgery side at
Yeah.
least, for a surgery that we do, we're like a third to a quarter of the price that they would pay cash at a hospital for the same surgery,
Wow.
right? So it's significantly cheaper overall because
Hmm.
there's no fat to be trimmed by some, big
Yeah.
hospital
Yep.
or insurance
There's no
company
bloat.
that's, yeah,
Right.
they're like the only people that are getting paid are the people providing the service, whether it's
Yeah.
anesthesia, the facility, or the surgeon,
Hmm.
right? You're not paying a coder who's not adding value. You're
Yeah.
not paying, somebody who rejects the claim. All these
Hmm.
people that are the middlemen who in
On the
traditional
payroll.
need
Hmm.
to be paid,
Yeah.
right?
It's
So
kind of
it's
like the
actually
plastic
cheaper.
surgery model. Is that similar?
Yeah,
Can we
yeah,
call it
you know
that?
what? Yes, it's. I would say it's similar to plastic surgery and LASIK surgery, right? So
Hmm.
we've seen free market
Elective
principles
surgery.
in healthcare
Hmm.
work
Hmm.
because those prices over time have come down and the
Hmm.
quality has gone up. And a lot of the detractors of, patients shopping around for services will say, well, patients don't know what to look for and they're uninformed of what's going on. And I say, like, no, that's actually not true, right? Like, people know what to look for even in medicine. It's a service like any other,
Hmm.
just like you know how to pick whatever service you want to, any service you want to choose that you have to pick from, you
Hmm.
know how to find the quality, whether it's your own search or word of mouth or whatever. Like,
Hmm.
you will know who's good and who's not.
Yep.
And I don't
That's
think it's
definitely where
fair.
the puck, sorry to interrupt, that's
Yeah.
where the puck is headed. As I mentioned earlier in the conversation, one of my former guests, Dr. John Porterfield, who's at UAB, but also an entrepreneur, he has a company called Informed Surgical. And they're doing exactly what you just described. They're actually giving only to the people that are subscribed to them access to surgical scores, meaning they risk stratify every surgeon in their network and they then let the patient decide where they go to have their surgery based on their reputation, their scores, their outcomes, et cetera, which is obviously a little different, but I could definitely see some synergy between your company and their company because you're both approaching it from a patient proposition and really what's best for the patient. And I totally agree with you. I think patients like myself as well are getting more they're owning their own health and realizing they do have those decisions they can make. They're not relying on their insurance and who they say they can go to, and people are being much more pronounced in how they manage themselves. So I
Yeah.
think
And I think that's the problem with insurance is
mhm,
the insurance companies and when you do everything through insurance is a very paternalistic type of relationship.
yeah.
And now, like you're saying, exactly that. Patients are taking their own health into their own hands
Mhm.
and they want to make the decisions because, and this is where it comes back to economics. So I'm a big proponent, and so is Surgery Center of Oklahoma, of something called Austrian economics, which is one of their main things that they talk about is the subjective nature of value. So the only person that should choose what's valuable is the consumer, the patient.
Mhm.
Nowhere else is that talked about. It's really funny. Like, I sit on these national committees for like trauma and on their healthcare economics committee meetings. And they're pontificating like, how do we measure value? And I'm like, why are you measuring value for somebody else? And this
Yeah.
is actually a post that's going to come out within the next week on my LinkedIn. I had a patient that I saw in telehealth as a pre-op
Mhm.
for I don't know what it was, like a hernia, I think,
Mhm.
and it was telehealth. He was on his phone, just like kind of FaceTiming with me, and that's how I did the visit. He was in the break room of his work. He never left work. He didn't wait 2 hours to see me. He didn't drive 30 minutes each way to see
Mhm.
me. That was valuable to him. He didn't have to take a day
Hugely.
off of work, right?
Yeah.
That's a value that doesn't show up anywhere in a
Mhm.
value equation, and that's
Mhm.
certainly not something that somebody on a committee will say, oh, you know what, there's value in that, right? But for that patient, there was value, and
Right.
that's where the subjective, value comes from.
Yeah, I love that. I actually, now that we're kind of breaking it down and looking at it objectively and kind of from a zoom out, it's a huge deal for patients because, and I you didn't mention this, and I think I saw it in one of the earlier posts, which is what made me reach out to you. But in remote areas, small towns, I came from a really small town, not the Appleton, Wisconsin version of it, but another Northern California small town. And my sister had to have her gallbladder taken out. And, of course, at that time, I worked in robotics and knew every single surgeon in town, but I didn't know anyone in Yuba City because it's a small town and it's a small hospital. And they did not have access to, I got to be careful how I say it. They had a different standard, right, for their care. And it was so sad for me to watch. Like, you're really at the mercy of the surgeons in your community and those that decide to live there long term, right? And that was such a bummer for her. I mean, it ended up being fine, but we really didn't get her, the best care that she could have gotten and probably could have, really benefited from something like this. So I think about your solution, and I know you're just getting started, with your footprint at this point, but I would think these smaller towns where they do have an active ASC would really love to have people of high caliber come in and out, for surgeries for their patient community. And that's a huge upside for them. Because the other ASCs they're competing with for the same patient population are at the mercy of just who lives in that geography, right?
Yeah, so I think that's a great point, and now can go back to what you were asking about with aviation. So,
Hmm.
especially with the aviation component, yes, we can bring the top-notch surgeons who always choose to be in the metropolitan
Of
areas
course.
because that's
Yes.
where the academic center is, right?
Yeah.
They want to be affiliated with the academic center, but they
Hmm.
don't want to live in the middle of nowhere.
Right.
We can bring those surgeons to that facility for a day or a day and a half.
Hmm.
There's, I think, about 3,500 airports across the United States.
Hmm.
We can fly basically anywhere that'll be within 20 minutes to an ASC.
Hmm.
Um, in fact, that's what I do with between Connecticut and Pennsylvania. I live 15 minutes from the airport in Connecticut, and my hospital in Pennsylvania is 15 minutes away. When I fly to Wisconsin, it's a 5-minute drive from the airport to the ASC.
Yeah.
And yeah, I have surgeons, especially, you know, in Connecticut, I have some orthopedic surgeons who say, "Hey, I want in, like let me come on board." And for me, it's like, sure, the more specialists that I take on my plane to a facility and say, you know what, we're going to spend 2 days. I'll be doing general surgery for 2 days. You do orthopedic surgery for 2 days.
Hmm.
We come in, we do the surgeries, we leave. Going back to one of your previous questions, though, one of the things that people ask all the time is like, oh, what about pre and post op care?
Hmm.
So it depends on, what kind of care we're talking about. Um, Most of the stuff can be handled locally with either the DPCs
Hmm.
or local physical therapists for orthopedics. Very little of it needs to be taken care of by the specialist again. But what I see happening is, depending on the need, we could be there potentially on a weekly basis, and not necessarily the same surgeon, right? That same surgeon who I mentioned before may have a full-time practice in the
Hmm.
metropolitan area and only want to give 2 days a month to this.
Right.
But if I have 4 different specialists within the same specialty going once a week, and they cover for each other as a team sport,
Right.
right?
Almost like virtual on call.
Yeah.
Yeah.
So, like, you know what? Okay, if you have a complication, well, I'm bringing this guy's partner next week. It
Right.
may not be the surgeon who did your surgery, but
Right.
you're both, it's the same specialist.
Right.
We're going to be there next Wednesday. Come into the office to see us, you
Yeah.
know?
Well, I personally love where you're going with this. I think you're just scratching the surface. I definitely think everything's moving to self serve, everything, because no one wants to be a part of any system anymore, because there's a lack of trust in the system. So I think anytime you can put matters into your own hands and you can find the best care for you and your family, and it's convenient and you're the hero in the story and not the insurance company or anyone else, you're going to win 100% of the time. It's just a matter of time before people kind of wake up and realize this isn't serving me anymore. This traditional way of doing things isn't in my best interest. And this is a much better. That's why I moved over to concierge medicine for the exact same reason. And, it's not a perfect science either. And you're still paying out of pocket every month, but I definitely think I feel more in charge, and everything's through an app. And so you have access to your care, and it's just a little bit more civilized than what you had described before, sitting in this long bureaucratic process where you're just a number or a patient ID and there isn't really any intimate or personal connection. So I applaud you for doing this. And I know it's partly a passion project, but also something that will probably be very disruptive to the surgical market. I can only imagine. All right, let's finish out with our speed round of questions because I prepped you. You should have some idea, but let's just do it really quick because every guest speaker has the same questions. So, in no particular order, you can answer them any way you want. Who's a mentor and why, and who you want to pay it forward to? A book that's made an impact on you, either personally or professionally, and then also a superpower that's specific to you.
Okay, so I would say a mentor and somebody that I look up to all the time is my dad. Um, he unfortunately passed away in 2011 when I was a resident, but
Mm,
um, he was like my biggest fan,
mm,
and I might get emotional now, but I kind of, I'm sure he's watching from somewhere, and very proud of where I'm at now. I think he would be super proud of this project and everything that I've been doing and the life that I've built. So um, I owe it to him. Really, again, he was not in medicine. All he was just supportive of education. So he said, whatever you want to learn, like I'll support it, whether it was flying or engineering or when I decided to go to med school. Like he was never like, okay, no, enough. Like you got to start,
mhm.
working. He was just like, okay, if you're going to be learning something, I'm fine with that. And, owe him everything.
Sounds like a
Uh,
really good dude.
yeah. A book, I would say, I'm a huge fan of Thomas Sowell. He's an economist. I might have mentioned him before, but his book, Basic Economics, is a really thick book and it looks very intimidating, but it's not at all. There's not a single equation in that whole book. I read it when I was a resident, I think again in 2010, maybe a little after.
Mhm.
And it didn't teach me just economics, or maybe it did teach me economics, but I would say it taught me how to think.
Mm,
I would say that I think very differently about different subjects because of how he teaches you to think about things, where you don't just look at things superficially or like second order or third order, but you really have to delve deep into what does it mean if you're going to do this or this policy, what are the implications, and you have to like really think about all the depths that'll go into. So I would recommend that to anybody, not just if they're interested in economics, but again, just to have a different perspective on the world. And I think it made me a better entrepreneur
mhm,
because I think differently because of that book. And then my superpower is, again, I just like I said before, I could sit for hours at Starbucks or a coffee shop and
mhm,
read. And I read a lot about most of these things that I'm passionate about,
mhm.
and those are foundational to the business and who I am. So yeah, just like tenacity to be able to sit and kind of grind through what most people will not be able to. I think over the years, especially with the iPhone, my
Yeah.
attention span has gotten,
We've
you
all
know,
gotten ADD
lost.
from, yes,
Yeah.
social media
But
and the notifications.
once in a while, if there's a book that I'm really into, I could really sit
Yeah,
down and like
you can
just
lock in.
stare down. Yeah.
Got it.
Yeah.
Well, that's really cool. Those are answers I haven't gotten before. I think going back to this basic economics book, it's really probably sounds like it's pronouncing the art of critical thinking, and I think that's unfortunately been somewhat lost on our new society. And anytime you can learn how to be critical in your thought and just dive a little deeper than superficial and surface level, I think you're going to benefit. And I'm a big fan of reading as well. I think everyone needs to be constant learners. You don't just get what you get in elementary school or college or even residency. You have to constantly be evolving, not to mention it manages brain health. So if you're not using your brain, it's going to shut down. So I love those answers. Those are great. Well, Dr. Elefant, thank you so much for being on Leadr podcast today. It was a huge pleasure. And I'm actually really, really interested. We should definitely keep in touch because I know a lot of people in surgery. And I also know a lot of people in the ASC world. And so we should definitely keep in contact about that. And I see big things for ACEs. I really do. Absolutely.